Welcome. Today we're diving into a condition that can significantly impact a person's quality of life, urethral fistula. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. Understanding this condition is the first step towards managing it effectively. Let's get started. Urethral fistula refers to an abnormal connection between the urethra and another organ or the skin. Several factors can lead to the development of this condition. One common cause is trauma, such as injuries from pelvic fractures or surgical procedures. Urethral instrumentation, like repeated catheterizations, can also damage the urethral wall, predisposing it to fistula formation. Another significant cause, particularly in developing countries, is prolonged obstructed labor in women, leading to pressure necrosis of the tissues between the urethra and vagina. Less common causes include infections, inflammatory bowel disease like Crohn's disease, and even certain cancers in the pelvic region. In rare cases, it can be congenital, meaning it's present at birth. The pathophysiology of a urethral fistula involves a breakdown in the normal anatomical barriers. Damage to the urethral wall, whether from trauma, surgery, or prolonged pressure, initiates an inflammatory response. This inflammation can lead to tissue necrosis or death, particularly if blood supply is compromised. The necrotic tissue creates a channel, or fistula, that connects the urethra to a nearby structure like the vagina, rectum, or skin. This abnormal connection allows urine to leak through the fistula, bypassing the normal urinary pathway. The continuous leakage of urine can cause irritation, infection, and further tissue damage, perpetuating the problem. The prevalence of urethral fistula varies greatly depending on geographic location and access to health care. In developed countries, iatrogenic causes, meaning those related to medical procedures, are more common. This includes fistulas resulting from surgeries like prostatectomy or urethral reconstruction. In developing countries, obstetric fistulas, caused by prolonged obstructed labor, are significantly more prevalent, especially in areas with limited access to skilled obstetric care. While urethral fistulas can occur in both men and women, certain types, such as vesicovaginal urethral fistulas, are exclusively seen in women. Overall, the condition is relatively rare, but it's important to recognize the underlying risk factors and address them to prevent future occurrences. The symptoms of a urethral fistula can be quite distressing and significantly impact daily life. The most common symptom is the involuntary leakage of urine. This leakage may occur through the urethra, vagina, rectum, or through an opening in the skin, depending on the location of the fistula. Other symptoms can include recurrent urinary tract infections, skin irritation or dermatitis around the fistula site, and pain or discomfort in the pelvic region. In women, leakage of urine into the vagina can cause vaginal odor and discomfort. In men, leakage through the skin can lead to skin breakdown and infection. The severity of symptoms often depends on the size and location of the fistula. Diagnosing a urethral fistula involves a thorough medical history, physical examination, and various diagnostic tests. The doctor will inquire about your symptoms, any prior surgeries or injuries, and your medical history. A physical examination will involve inspecting the perineal area for any visible openings or signs of inflammation. Specific diagnostic tests might include avoiding cystoscopy, which is an X-ray taken while you urinate to visualize the urethra and bladder. A cystoscopy involves inserting a small camera into the urethra to directly visualize the urethral lining and identify the fistula. A fistulogram, where contrast dye is injected into the suspected fistula, can help map out the fistula tract. Additional tests, like urine cultures, may be performed to rule out infections. Urethral fistulas can be classified based on their location and the organs they connect. For example, a urethrocutaneous fistula connects the urethra to the skin. A urethrovaginal fistula connects the urethra to the vagina. A recturethral fistula connects the urethra to the rectum. They can also be categorized based on their obstetric, traumatic, surgical, or congenital. Understanding the specific type of fistula is crucial for determining the most appropriate treatment approach. Treatment for urethral fistula typically involves surgical repair to close the abnormal connection. The specific surgical technique depends on the size, location, and cause of the fistula, as well as the overall health of the patient. Small fistulas may be repaired with a simple surgical closure, while larger or more complex fistulas may require tissue grafts or flaps to provide additional support and blood supply. In some cases, a urinary catheter may be placed for a period of time after surgery to allow the tissues to heal. Non-surgical management, such as bladder drainage via catheterization, may be used temporarily to manage symptoms while awaiting surgery or in patients who are not surgical candidates. Antibiotics are often used to treat or prevent urinary tract infections. Preventing urethral fistulas involves addressing the underlying risk factors. In developing countries, improving access to skilled obstetric care and timely cesarean sections can significantly reduce the incidence of obstetric fistulas. In developed countries, meticulous surgical technique during pelvic surgeries and careful handling of urethral instrumentation can minimize the risk of iatrogenic fistulas. Prompt management of urinary tract infections and inflammatory bowel disease can also help prevent the development of fistulas in susceptible individuals. Patient education regarding proper catheter care can also help prevent fistulas related to catheterization. The prognosis for urethral fistula repair is generally good, with high success rates achieved through surgical intervention. However, factors like the size and complexity of the fistula, the presence of infection or inflammation, and the overall health of the patient can affect the outcome. Recurrence is possible, especially in cases involving significant tissue damage or infection. Recent research focuses on improving surgical techniques and materials to enhance fistula closure and minimize recurrence. Advancements in minimally invasive surgical approaches, such as laparoscopic and robotic surgery, are also showing promise in treating certain types of urethral fistulas, leading to faster recovery times and reduced complications. Continued research is essential to further improve the management and prevention of this challenging condition.